Hello guys, welcome to medicoding.com. So in this video, we are going to learn the component of operative report. Okay, so the operative report is the report of the surgery. So it means how the physician is planned the surgery, how they are performing, and what are the outcome of the surgical procedure. So we will see each component in detail, so it will be easy to read the operative notes and we can get useful information required for coding. So the first information in the component of the OP report, that is patient identification. So the patient identification, like the patient name, age, gender, male or female, then hospital number, like MRN number. That is the unique number that will be able to identify the patient details. Then date of surgery. Okay. So why this information is essential? It is because to match the correct patient. Also, for CPT coding, the age is very important because for some CPT, the age will change the CPT code. Like here, CPT 54160. The CPT code will be changed for 28 days of age or less. But if the patient has more than 28 days, the CPT will change like 54161 here. That's why here the age is important. In other, the sex, that is the gender of the male, the patient gender. So some CPT is only allocated to particular gender. Like you can see here, 52270. This CPT is only for the female. For the male, you can't give this CPT. So that's why this information is essential. Okay? If you want to get complete training of surgery with interview preparation, then click on the link and enroll for the training. We have trainer having good experience in training. We will not give training that is given by CPC trainer. We will show you the operative report and discuss the depth knowledge of surgery. The next is the preoperative details, like preoperative diagnosis, indication for the surgery. So the surgery is not always planned instantly. The surgery is always will be the last option. So here, the diagnosis before the procedure, that is reason of surgery, that is known as preoperative diagnosis, means diagnosis before the procedure. So preoperative diagnosis is identified by any diagnostic procedure like X-ray, MRI, or maybe through biopsy. And the indication. Indication is very important to understand the scenario, how the patient is, what are the situations, what are the history of the patient, and what are the medical history or why they planned for this surgery. So in this indication, they mention all such information. You can see here for this indication, the patient has osteoarthritis of the knee. So the patient have pain, stiffness. So this is limiting the daily activity. Okay, they tried medication here also, intra-articular injection, but it is not improving. Okay, it means conservative management is not helping. Also, the radiological evaluation, based on that, they find the knee has degenerative changes, that is, osteoarthritis. So, these all are the indications. So, indication helps you to understand the patient's situation. So, if some ICD need more details, then this will provide additional information. Note, post-op diagnosis is considered as final diagnosis because sometime it will change to pre-operative diagnosis. So the next component is operative detail, like what are the procedures performed, who is the surgeon, who is the assistant, and the type of the anesthesia given. You know, the anesthesia type is very important because for some particular CPT, if the mode of anesthesia is changed, then the CPT will be changed. So some CPT is only dedicated to local anesthesia, and that particular CPT is only dedicated to general anesthesia. So these are the criteria that the CPT will change based on the type of anesthesia. So that's why it is also important. And the surgeon and the assistant. So if the assistant is helping the physician, then we have to also code for the assistant with modifier. Okay? And next, the name of the procedure performed means what are the planned procedures, what they are planning to perform. That is considered as the name of the procedure. So, based on the header, you can get what procedure performed. But sometimes, due to some complication or due to some problem, the procedure may not complete. So, don't always go with the header, like they mention knee arthroplasty. It may be that some complications they are not able to perform. We have to see the complete description of the OP note. So the next component is incision and finding. You can say only findings because incision they give on the detailed description. Okay? So only finding. So finding are the way to give the diagnosis and what are the complications occur. The physician gives some findings. So, in finding, you will get some additional diagnosis that is not in the pre op diagnosis. That is because of that surgery, because of doing incision, because of going inside, they are able to find this diagnosis that is known as operative finding. Also, some complications occurs that is also dictated in operative finding. So this is also very important component for the surgery coder. So the main body of the report, that is the procedure description. This is very, very important. The procedure description is the detail of the procedure. So they give step by step what procedure is performed, and here in this description, they used to mention what incision they perform, how they are entering into the surgical area. So they used to mention which muscles they are removing, which component of body they are cutting. So that's why anatomy is here very important in surgery, because based on the anatomical location, you can find the location. Okay, so the procedure description is all the information, all the detail of the surgery. Okay, so in the procedure description also, firstly, they used to mention preparation, how they are preparing the patient, what is the position of the patient, supine position or the prone position. Okay, so this all are included in the procedure description. So the next component is the closure, and this is included in the last paragraph of the procedure description. So closure means closing an incision. Is they are placing any drain or not? Okay. So the closure based on the layer, we can give the CPT code. Either it is a simple, intermediate, or the complex. What are the sutures physician used to mention? Like Vicryl 1, Vicryl 4. Our motive is tell thee about the detail of component so that you can understand the importance of operative report. The next is the post-operative details. Like after the procedure, the patient they mention that what are the specimens they are sending, what are the final post-op diagnosis. They are usually dictated in the header. But after and during the surgery, they found all these things they used to mention. These details they used to mention in header of op report, like how many milliliters of the blood loss, what are the specimens taken. So if they mention a specimen sent, so we have some pathology report. So we can find the pathology report and we'll give the final diagnosis. Okay? So in post-operative detail, physician mentioned the patient was well, they tolerated well. So they also tell the condition of the patient, okay? After sending to the post-operative care, the patient sometimes may have given injection for the nerve block, that is for post-operative pain. And that is given by the anesthesiologist. Not so that is need to be coded separately. And the last important is the signature, okay? This is the very important component. So if you miss the signature is not there, and you are coding the chart, that is a very big mistake, okay? The client will get angry, the claim will deny, and it is like a means invalid coding, okay? All this means the chart needs to be query. So this is the sample operative report for procedure colonoscopy. Colonoscopy is minor procedure. For major surgical procedure like arthroplasty, operative report format will be different. I forget to mention this component, that is the insurance, okay? I didn't discuss in above. So the insurance is important because for some particular CPT, for Medicare the CPT is different, for non-Medicare the CPT will be different. Next, admission type, outpatient. This is used for the billing purpose, like the place of the service. You also should know the place of the service, like for outpatient 22, inpatient 21. This report is short. So here is the indication. Then the anesthesia. Okay, this should not be medication, this should be anesthesia. Then complication, specimen. They used to mention what is the specimen they are taking. Okay, so this is the procedure description. Then this is very minor procedure. The scope is inserted, so they will not make an incision because this is the endoscopy procedure. After that, what are the findings they discuss here and what are the impressions? Let's see the sample of pathology report. Okay, this is the sample of pathology report. So, physician performed polypectomy. Okay, the diagnosis of the polyps only is different. But here you can see in path, so there is a adenoma. So, polyps diagnosis will be changed to adenoma. So, our ICD is getting changed based on this pathology report. That's why for the correct coding, you need pathology report. So in this video, we found all detail about the surgery report. If you want to attend training of surgery coding by our trainer, you can click on the link and enroll for the training. Please subscribe if you are watching this in YouTube.